I remember a day when I was asked to observe a trainee with their client. Despite my trainee being a budding scientist who was intelligent and clever, I was surprised to see them struggling to build rapport, faltering, unable to communicate the theory effectively to their client. The client looked confused and distressed, and so did the trainee. It struck me how without the skills to implement the theory, the trainee clinician is limited in their effectiveness. It's so important for a clinical psychologist to draw on theory, but also have the skills necessary to implement the theory into their practice. In some psychology departments, people joke that the scientists are down one end of the corridor and the practitioners are down the other end, and never the twain shall meet. I believe clinical psychology requires a commitment to both theory and practice in trainees. Over many years of teaching, I've seen some trainees who are able to embody the knowledge and theory and skillfully implement it, and it comes together beautifully. It leaves both client and therapist feeling content and satisfied with the encounter. And to watch it, it's like poetry. So when I was offered the opportunity to be involved in developing a brand new clinical psychology training course at UTS, I jumped at the chance. The challenge for me was to develop a course that honours the scientist-practitioner model by bridging the gap between clinical research and clinical practice. I wanted this to happen in 3 ways. 1, in a real-life setting. 2, to be beneficial as a community service. And 3, to enable research into mental health problems to support best practice treatment options. Since we opened in July 2015, we've been very busy. The UTS Psychology Clinic has seen over 600 clients, and we're growing. The Psychology Clinic is staffed by trainees who are closely supervised by a team of clinical psychologists who are both academics and practitioners. The clinic service provides low-cost psychological assessment and treatment for a wide range of mental health problems. It draws on the teaching and expertise of academics in cognitive and behavioural therapies for areas such as anxiety, depression and trauma. The clinic provides services to UTS students, to staff and the wider community. And now we're establishing research clinics, which will enable us to utilise our practice to inform the theory and science. So far we've established the Child and Family Behaviour Clinic, the Mindfulness Integrated Therapies Research Clinic, and soon the Multidisciplinary Back Pain Clinic. Whether you're interested in treatment or participating in research, you can contact us on the email below. If you'd like to study with us, visit our website to discover more. The UTS Clinical Psychology Training Model ensures there are no walls or corridors between scientists and practitioners.